My name is Nolsoe. I'm a medical doctor from Denmark. I'm a radiologist. I work in the department of surgery, gastroenterology surgery. I do interventions with ultrasound every day. We do a lot of ablations in the liver for liver metastasis, and for that purpose I use ultrasound every day. I'm also the immediate past president of the EFSUM, which is the European Federation of Ultrasound Societies, and currently I am on the board of Education Committee of the World Federation, which is the umbrella for federations for the continents of the world. One of our focus is in both federations the use of ultrasound, contrast ultrasound, and providing guidelines for the use of that. We have just recently had our world meeting in Vienna, and on that occasion we issued the third update of our guidelines for non-liver indications of CEUs, which is contrast enhanced ultrasound. Like I said, I use it every day for when we have performed an ablation in the liver. If the tissue is truly dead, then there will be no contrast uptake, and that is our way to see on a daily basis if the ablation of the patient's malignant tumor is okay. Around us, people are using it for so many different applications that before we did this article, even didn't know that you could use it for so many different things. I think the only thing that put a limit to it is your own fantasy or imagination. Having said that though, these contrast agents are only approved for certain very narrow indications. One of them is that what I'm using it for, microvascularization. One of the big ones is cardiac. Small one is reflux study for urethral reflux. But most of the other indications are off-label. And one of the reasons we are doing these guidelines is that we want to put focus on developing ways to have this approved for use in all the other areas. And also to have it as a document when you have a patient where you would like to use it and it is off-label, how to explain to the patient why is it that we want to use it and how safe is it to use it. And truly safe, it is truly safe. Ultrasound contrast agents are among the most safe contrast agents we have. It's the likelihood or the risk of having an adverse reaction like anaphylactoid reaction is 1 to 10,000, which is, I mean, like drinking water or something like that. It's very, very safe to use. You can use it also if you have impaired renal function, which is a major contraindication to use CT and MRI contrast agents. There's no problem with ultrasound contrast agents. So there are many advantages. I think I can keep on for a long time, but maybe you want to.
Wonderful.
Truly speaking, ultrasound is without radiation, can be done regardless of the situation of the patient. You can move the equipment all around, take it, even put it in your backpack and go into the field. And you can still out there use contrast ultrasound because you can bring it with you and you can use it in an ambulance, you can use it all over. So it has all the profile of being the drug or the thing to use for imaging. But the major drawback is the approval. I know you in the United States, you face the FDA boxed warning. That is a major reason it's not being used in the United States, except now in cardiology. In Europe, we are lucky not to have that limitation, so it's used widely all over the European continent for increasing, almost exponentially increasing number of applications. We do have one issue though, and that is in pediatrics, because in pediatrics, like any other indication except for the cardiac and the major vascular, it's off-label. And that means that we have to explain every time we use it, which can be difficult to explain to the parents of a sick child. So we are working hard to get it approved, but it takes what it takes, and that's a phase 3 clinical trial, and that's a lot of money. And in the meantime, maybe some children are getting a substitute, which would be a CT scan with radiation, for something that could be solved with ultrasound and contrast agents without any radiation, no risk. So that's a dilemma that we are trying to solve.
Great. Could you speak just a moment about cancer? And if you did already while I was out, I apologize. But one of the things that I had heard is that contrast ultrasound allows you to pick up a cancer perhaps earlier than you might using other imaging modalities. Is that correct?
That's correct. Like I'm saying, my daily work is in a department of gastroenterology surgery, dealing with liver cancers, liver metastases. And what we do is we stick in a needle and cook it away. It's called ablation. In cases where chemotherapy is not enough. Now you cannot put a needle into something you cannot see. Sometimes on a standard ultrasound scan, you may not see small tiny lesions, or it can even be bigger lesions that do not stand out because of the acoustic properties. Then sometimes if you inject ultrasound contrast, you can actually visualize what was not visualized before. So you can pick up either tiny small ones or sometimes one that are not conspicuous, or that's not easy to see with fundamental ultrasound, enabling us to do biopsies and treatment and ablation of tumors that otherwise we could not do.